I'm Dr. John Chessare, the President and CEO of GBMC HealthCare. If we start by saying that healthcare is poorly designed, we have to have a mechanism to redesign the care. Unfortunately, we can't just shut down and go off for a few years and redesign the entire system. So we need a company of focused problem solvers. We need to move improvement to the top of the agenda. When you are in a system where you're under pressure all the time and you're the manager, by nature you push the improvement work off to the background because you're putting fires out all day long. You're fixing problems. What you don't realize is you're fixing the same problem over and over again. So LDM, Lean Daily Management, is a technique to move improvement to the top of the agenda. So every day, the executives present their own metrics at our executive board. Then we divide into 5 teams. Each team goes on a walk. They visit 6 or 7 departments. We follow a script. The script takes about 3 minutes. The local leader presents how he or she and their department did the previous day on a set of metrics under our 4 aims. Why? Because this is about driving us towards that vision of the best health outcome with the best care experience, with the least waste and the most joy for those providing the care. So we set our annual goals under those aims, and then the managers say, what do I need to improve within my department under those 4 aims to move the GBMC healthcare system closer to its vision? So they pick those metrics. They then present whether or not they achieved their goal, and if they didn't, what was the reason for the defect. They ask a set of why questions. If it's that the patient did not have all the high fall risk elements in place, gee, that's interesting. Why was the bed alarm not reset? Once they get to the last why, the answer, the deep learning, they ask themselves, what might we change to make sure that that bed alarm is reset the next time? And they test the change, and then the subsequent days, we see the effects of the tests of change. So under best health outcomes in fiscal 2012, we had 21 serious safety events at GBMC Hospital and in the healthcare system. And we had 7 retained foreign objects. We have now gone almost 2 years without a retained foreign object. And in the fiscal year that just ended June 30th, we had 3 serious safety events as defined by the Maryland Healthcare Commission. We had 2 falls and a late diagnosis. So we've made incredible improvements. Under More Joy, we've reduced our average monthly employee injuries from 35 to 40 per month down to we've now gone 8 consecutive months with less than 10. We've pretty much eliminated slips and falls. We've pretty much eliminated back injuries from lifting. And we're very happy with making our employees safer. Missing medications. We used to have 30 or 40 missing medications on a unit per day. Can you imagine on a unit with 30 patients that 30 different times in a 24-hour period a nurse went to give a medicine and it wasn't on the unit? And now it is a relatively rare event that a nurse goes to give a medication and it is not present on the unit. These achievements have all been achieved through scientific management, through studying defects, learning the cause, and then testing changes and moving to better standard work.